Fine. So have we checked the sound? Have we checked that the sound's working?
Yes.
Fine. Okay, so welcome to all members and welcome to any members of the public who are watching this on the webcast. This is the very first of the Adult Social Care Health Committee as we move into our new system of governance here at the Council. So now that we know for sure that sound is working, can I ask our Legal Services Officer to undertake a roll call of the members present, please?
Good evening, members. Could Councillor Bruce Berry confirm that he's present?
Good evening. Yes, I'm present.
Councillor Burgess-Joyce?
Good evening. Present, Vicky. Thank you.
Councillor Collins?
Evening, Vicky. Present.
Councillor Cottier?
Good evening, all. Present.
Councillor Frost?
Good evening, all. Present.
Councillor Gilchrist?
Yes, good evening, everyone. I'm present. Thank you.
Councillor Sharon Jones? Don't think Councillor Jones has joined us yet. Councillor Jordan?
Evening, I'm present.
Councillor McLaughlin?
Evening, I'm present.
And of course, Councillor Nolan's present because she's chairing.
Yes, I am. I'm definitely here. So
it's just Councillor Jones who's missing, Chair.
Okay. Well, thank you for that, Vicky. And just,
Sorry to interrupt, Chair. Just letting you know that I'm present as well as Councillor Usher.
Sorry, Councillor Usher. I missed you off the list, didn't I?
No problem. No problem.
did this happen to you at school, Tom, when you were always at the bottom of the list as well?
Always last, Yvonne. Yeah, always last, Chair.
I can imagine. Right, so just to alert people and to alert members and to remind those people who are watching the webcast at home, it will be webcast and a record will be retained on the council website. If you are watching at home, if you look above the video, you will see a resources tab. You select this and a link to the agenda, which appears on the right-hand side. This will allow you to open the agenda in a PDF form, and that makes it easier for you to follow the discussion and the debate. So we hope that you'll be able to do that. Okay. So, do we have any apologies for absence?
No, Chair. This is Patrick from Committee Services. No, we have no apologies.
Okay. And do we have any members who want to declare any interests in the items on the agenda for the meeting tonight, for the public part of the meeting?
Councillor Cottier, can I declare that my wife works as a nurse at Cllr House?
Thank you, Councillor. This is about interest for the public part of the meeting.
I think Councillor Jordan wants to declare an interest, Councillor. No.
Sorry, yeah, there we go, Councillor Jordan. I've seen your hand now. Thank you.
It's okay, thank you. I declare an interest in the fact that I work for the NHS. My son works for the NHS, and I'm also a trustee for Incubabies.
Thank you very much. Councillor Jordan, do you have any others?
Councillor Usher also has his hand up, Chair.
Sorry, I've seen Councillor Usher.
Thank you, Chair. I think I need to declare a pecuniary interest on the real living wage item due to my employment by Autism Together. So I have been advised to leave the meeting during the item.
Thank you. I don't think that's an item that is coming up in the public part of the meeting, Councillor Usher, but if it does, then obviously you'll take the appropriate action. Thank you. Right. Have we been notified of any public questions or any statements by members of the public?
No, Chair, there's no questions that have been submitted prior to the meeting. I'm not aware of anybody who wishes to make a statement this evening.
So in which case, I'm assuming that Julie Webster, our Director of Public Health, is here, and that Julie will present the report, which is the next item on the agenda, and clearly it's a for us. And before you start, Julie, and I'm sure that the rest of the committee will support me in this, in saying how much we value and recognise the phenomenal amount of work that's been undertaken, not just by yourself, but by all the council officers. But clearly, a lot of the responsibility falls on your team in this, and this is very much appreciated and very much valued by this committee. So please, please do accept our gratitude and our recognition for what you're doing. Thank you.
Thank you very much, Councillor, and I absolutely acknowledge your comments and absolutely support your views that this is about a team effort. So thank you very much. Shall I move into the committee report now?
Yes.
Okay, thank you.
So please speak to the report that members have had, yeah.
Thank you. So obviously this is a very fast-moving situation, as you'll all be aware, and obviously there's been announcements over the past couple of days around the particular stage of the pandemic that we're in, and particularly for the impact on Liverpool City region. The report that you've got in front of you was actually written at a point in time, and I think that's what we're finding with COVID-19, is it's something that definitely keeps you on your toes. So the report that you've got in front of you is really how we are planning to live with COVID-19 as we wait for a vaccine to be developed, more treatment options are available, and as we start to understand the virus better and understand about how individuals develop immunity to the virus. So this report very much, as I say, focuses on how we will keep Wirral well, and it has been published. It was published earlier this year, and it's on our website. It's focused around three key elements, which is prevention, control and management. Obviously, at this point in time, because of the scale of the number of virus cases we've got within the borough, this is work that's happening in the background to a degree as we react to the situation that we've got. But this is a really important piece of work, as I said, for us to be able to understand the impact in the borough. So that's why we've got an element in there around our intelligence and surveillance, so that we've got a local surveillance system that's capturing data. We've got daily and weekly surveillance undertaken. You've got a copy of our weekly surveillance report at Appendix A as an example. This is updated weekly and published on the council website. We're also doing a significant amount of work with care homes and schools. We've put significant investment into our community infection prevention and control team to support care home settings with regard to keeping both residents and staff well and healthy. There's also, we've done a lot of work with our schools and nurseries, and we're very proud of the team that's been established and is working very closely with the head teachers who've done a brilliant job for schools and nurseries and keeping education available for the majority of our children. We're also working very closely with, it's termed high-risk workplaces, communities and locations. So that's places where we might see a number of cases emerging and needing to go in and make sure that there's compliance with guidance and making sure that any outbreak plans are in place. And we work closely with our licensing and environmental health teams around this. And there's commentary in the report that talks about the daily meetings that we have to review local situations requiring that support. And that's been a significant work stream that's stepped up over the last few weeks to make sure that we've got some COVID compliant businesses within the borough. And you can see on page, sorry, I haven't got the page number, but in the table under section 3, it's there's a reference there to over 700 businesses requesting a pack around their self-assessment scheme and compliance, and that's gone out to local businesses. We've also done significant work locally around working with the national testing scheme, and we've got 3 local testing sites that have been established, and we've got a 4th one coming online in Heswell, and we've kept the satellite testing centre at Bidston for the time being. We've also developed an outreach testing offer for vulnerable groups as well, and we are pushing hard on the prioritisation of testing of symptomatic key workers. So by that I mean frontline health and social care staff and teachers as well. And another important element that we've been working on over just this past, well, since the weekend, is around working with the national team to make sure that we've got a local contact tracing capacity, so that we can make contact with residents much more quickly than is happening at the moment. And then there's also commentary in there in the table actually around our comms and engagement work that we're doing to keep Wirral well, and I'm very proud of the work that the team have done in developing our Wirral community champions, and I know that some members have signed up to that campaign. And we work closely with our Merseyside Fire and Rescue colleagues, and we've worked very closely with the BAME community on the Wirral as well. So there's a great deal of work going on to, I suppose, a phrase that's used a lot these days is to do business as usual, because we know that COVID isn't going away and it keeps coming back and giving us all quite a shock. But we, as I said right at the beginning, until we've got a vaccine or we've got treatments, we've got to learn to live with it. And it's the work of the Outbreak hub that we've developed in the council, and the Outbreak plan and the Outbreak board that will help us to keep the borough working and to keep people healthy and well whilst we're waiting, as I say, for the virus to develop and for the various interventions that we need to be put into place. There's also commentary in the report about the Outbreak control plan and the grant that was awarded to Wirral Council, and the governance for the Outbreak plan, which is discharged via the Wirral Outbreak Board, which is chaired by the leader of the council. So, Chair, I've taken you through quite a whistle-stop tour of the report and the detailed work that's behind the Outbreak plan, and made reference to the data surveillance that we're doing as well. So I'll leave my commentary there, and obviously take questions as appropriate. Thank you.
Thank you very much for that, Julie. You're right, certainly was a whistle-stop tour, but I'm sure members will have questions, because there's a lot of information in your report, a lot of data in your report as well. And can I just say, Julie, in case you haven't seen the chat, that I have had support from all of the other parties on this committee for the comments I made, thanking you and your staff for the work that you're doing. So just thought you might like to know that. Councillor Jordan, is your hand actually up, or have you just forgotten to put it down? Thank you, Mary.
Sorry about that.
That's okay. I just wondered, do we have any questions? Councillor Frost.
Thanks, Chair. Thank you, Julie, for the report. The question for me is the one, same one as I posed to you yesterday. I just thought worth airing it here on this committee as well, around understanding the ethnicity data and the work that you've been doing with the BAME population on Wirral, as well as understanding the balance between confirmed cases and then COVID deaths that have been suffered on the Wirral, understanding the ethnicity data a little bit better. My perspective for other colleagues on the committee is that from the data that I've seen in the report pack, we seem to be following a different trend to what's been publicised in the media, as well as from other sources around the risk level. So probably not one for now, Julie, but one I'm sure other colleagues on the committee would welcome a level of understanding on that too when you're able to come back.
Yeah, certainly, Councillor Frost. So what I'll do is I'll get a briefing note done for committee members with regard to, because we have done a detailed piece of work around ethnicity, because obviously early on in the pandemic there was a great deal of concern, and rightly so, about the impact on BAME communities, and so we wanted to look at that in detail locally. So I'll forward that report to the committee clerk for circulation to all members. But I think what we're seeing locally is very much reflecting the demographics that we have of our BAME community. So we're not seeing a skewed response, which is really good news for the BAME community locally.
Fantastic. Thank you, Julie.
Thank you.
Councillor Gilchrist.
Yeah, hope that's worked. Yes, thank you, Chair. I think because leading members have had a number of briefings with Julie, we hope, a good understanding of what's been going on, especially as our data in recent weeks, I believe, has improved. I was reading the document that was issued by SAGE yesterday, which has caused some interest. But one of the comments they said in that was more detailed data collection on the environments and occupations where people are interacting linked to the test and trace system. They saw that collection of data as clearly vital to their work, and I'm therefore pleased to hear that our officers have got a good handle on the various businesses and pubs and all the other organisations that we need to, shall I say, keep an eye on while we can, in order to keep an eye on the spread. But the other thing that was mentioned in the SAGE report was several references to the impact of the virus on communities. In one of their sentences they say, often the poorest members of the community are more likely to experience the negative consequences of some of these interventions. Now, I've been looking at the Public Health England website off and on for several weeks, and I've seen the spread of cases in our borough, which not only is now happening in the poorer areas, but in many other areas, and therefore I'd welcome a comment on what our findings are at the moment on how the spread appears to be and how effective we are in working to tackle it. Thanks very much.
Thank you, Councillor Gilchrist. Yes, COVID does seem to be particularly focused in our more challenged communities. I think there's a link here to more crowded housing, and there's a link here as well to the type of occupation that individuals are doing. So they're more likely to be on the front line, more likely to be out and mixing with individuals. And we know that and that's why we've got the challenges and the restrictions we've got around household mixing and social distancing, etc., is to try and make sure that we've got the people aren't too close to one another. We are looking at this in detail, because there's obviously we are a challenged borough with our level of inequalities that we've got, and nationally the reports are that COVID is going to make our inequalities worse. So we're doing a piece of work at the moment to look at that in more detail, and I can bring that back to the committee for your comment and debate and instruction once that's available. But as you know, Councillor, initially we weren't seeing the east-west split in the borough that we're very familiar with, but unfortunately we are now starting to see that start to emerge.
Thank you for that answer. Thank you.
Thank you. Councillor McLaughlin, you've put a comment up around. Did you want to say something around that?
I'm quite happy to leave it in the chat box. It's basically a comment on the prevalence of COVID in the east side of the borough, or the poorer areas of the borough, and it's the fact also that those areas have got higher levels of poor underlying health among the population there. So that's going to be a contributory factor already, isn't it? Not to the numbers of COVID necessarily, but to the mortality levels, I dare say.
Yeah. Thank you for that. Councillor Jordan and then Councillor Burgess-Joyce.
Thank you, Chair. Thank you, Julie, for your report. I just wondered what the impact is at the moment on Arrow Park Hospital, both in terms of the amount of COVID cases in red zones and particularly in critical care, and the knock-on effect on other conditions such as cancer, heart disease, stroke, etc.
Yes, Councillor. So as of yesterday, we COVID in Arrow Park, and we had 19 people who were waiting for their result to come back, and unfortunately we had one death yesterday as well. So the number of cases in Arrow Park are going up, and they've been going up really since the beginning of September, in the same way as we've seen the increase in community transmission. So I'm sure you're aware that as community transmission starts to go up, then it's probably it's a little bit of a time lag, but then you'll see a corresponding increase in admissions into hospital. One of the challenges, I think the hospital's got a number of challenges, and Graham might well want to comment on this. The challenges are actually having people coming into the emergency department and then being admitted, say they've been admitted because they've had a heart attack, and then when they're tested for COVID, they're testing positive, but they've come in as asymptomatic. So they're having to deal with that. They're also obviously dealing with the fact that they are now working at a level to try and tackle the backlog of the waiting list that they've had. So they haven't stepped down any activity as far as I'm aware at the moment, but they're under significant pressures, obviously, both from increasing numbers of COVID cases and maintaining and trying to, as I've said, deal with the backlog from the waiting list because of the step down in services earlier in the year. And obviously, I'm sure again you're aware that the tier 3 restrictions that we're in at the moment within Liverpool City region certainly has been driven significantly by the hospital pressures, and certainly north of the river, that's been a major concern around the pressures that they're having. The other pressure for the hospital as well is because we've got community transmission, obviously that does mean there's an impact on their workforce, because their workforce, as we all know, are very much based on the Wirral, and if a member of staff becomes positive, then obviously they need to self-isolate. So that's also an issue for them as well. But I don't know if Graham wants to add any more about the hospital at this point.
I think that was a really helpful summary, Julie. I think the only things I'd add to that is that the situation is very tight, and one of the reasons it's very tight is that egress from the hospital also relies on the care sector, and we do have 21 care homes at the moment that have COVID positive status and are unable to admit people, so it's quite a big proportion of the sector. There's also an outstanding issue in relation to people who continue to test positive after 14 days, and we're working very hard to ensure that we've got the right pathways and processes in place for the care sector to be able to work safely with people. So I think that the hospital is in a situation at the moment where they are able to carry out the majority of activity. They are looking at outpatients, and outpatient is an area under pressure at the moment. And as they go forward and review what they can do in elective terms, then by elective I mean operations, planned operations, they will look at, I think, orthopaedics and ophthalmology first. Clearly, cancers and other urgent operations need to continue, but the pressure is getting very tight for them. They're at over 90% occupancy at the moment, so that does mean that a lot of their beds are full, and things are getting very, very tricky just because of the increase in numbers. When Julie mentioned the numbers there, I mean, there were 15 new people admitted in the last 24 hours, COVID positive. So, you know, that's the highest number in a day that we've had for quite some time. So it does mean that the situation is accelerating somewhat, and they expect it to get a lot worse in the next week or two.
Thank you. Thank you very much, Graham.
Thank you.
Right, we've got Councillor Cottier. Yes, I've seen your message that we've got a deputy for Councillor Jones who's waiting to join us. I'm not sure if that's been messaged through to committee services, but if not, I've got that message now. It's Councillor Cannon, and welcome to her. Will somebody let her in, please? Councillor Cottier, you had something you wanted to comment, wanted a question?
Not to be fair, at this right now, that was the point I was trying to get Councillor Cannon involved.
Right, okay. That's fine.
Chair,
yeah.
Councillor Cannon should be in the meeting now.
Thank you very much, Vicky. Yes, I believe she is.
Okay.
Appears to be, yeah. Thank you very much. Okay, we've got any other hands up? Are there any hands? Are there any hands that I can't see? Councillor Burgess-Joyce, you had your hand up before.
Thank you, Chair. Good evening, Julie. You're looking well despite everything, so well done to you, I have to say. Just very, very briefly, and it probably goes back to a little bit of what Sam Frost was saying before. If I'm looking correctly at the surveillance diagrams that you've got, page 8, if anyone's interested, at the bottom, something that may be worrying, and you can probably reassure us a little bit, is around the ethnicity of confirmed cases. Now, when we look at those figures, the known ethnicities look quite low, but what worries me is the grey areas of both confirmed cases and deaths. That's showing as not known. Now, is your experience that not known is just somebody's not chosen to fill that form in, or that we actually do have quite a large number of ethnic groups in that, and that we need to be adding some additional support to them because they are obviously far more vulnerable?
Yeah, and this is going to sound a dreadfully bureaucratic answer, Councillor. I'm afraid it's data quality issues, and I know this is something that we have picked up with our NHS colleagues because this is data we collect through the NHS. So we've asked our local clinical commissioning group to take this as an action to make sure that the recording of ethnicity is a lot better than it is at the moment. So there's an action plan behind the report that I'm going to send to Councillor Frost. So I suspect it's probably as well for me to include that action plan for you all as well, so you can see how we're trying to progress this. But you're right about the wrapping the support around the BAME communities, and
great. It's just that it just looked like we missed something because it's quite a large group. That was all. But yeah. Thanks for that, Julie. Thank you.
Thank you. I've got Councillor Frost. Councillor Cottier, you've still got your hand up. Is that a legacy hand? I don't know. Oh, it's gone now, so I assume it was.
Yes, it was. Apologies. Yes, it was. Sorry, Chair.
Councillor Frost.
Thanks, Chair. Thanks, Julie. My second question was just around, Julie, if you're able to share with us a similar pack that you mentioned around the track and trace in schools and how that's working in terms of how the data is being collected, and then how schools are ensuring that they're sharing with the borough any data of when children are off, not just off for sick, but off for COVID. Just a few reports from parents around, I guess, concerns that data isn't necessarily being recorded in school, so children are just reported as being absent, but not necessarily being the data being coded. It's definitely front of mind as you're mentioning your answer to Councillor Burgess-Joyce's question on data collection, and I know what the point that was made by Councillor Gilchrist earlier in terms of the quality of data being really imperative to making sure that your team is still able to do exactly everything they need to. So if you've got anything you could share just now, or if not afterwards, would be excellent. Thank you.
So there is a comprehensive data pack that's collected on a daily basis and reported in to Paul Boyce as Director of Children's Services. So I'll get a copy of that and get that shared with the committee.
Thank you.
Thank you. That will be really helpful. And if I can just welcome Councillor Cannon, and thank you for joining us at very short notice. I do hope you didn't end up with indigestion to make it into the meeting, but thank you for that.
That's okay, Chair.
Right, I can't see any other hands, and I can't see any other comments. Oh, got a comment from Councillor Gilchrist.
Yes, Chair. I just put something in the chat which I thought was appropriate, but I'm happy for you to look at it and seek comments of members.
Right. You're wanting to record its thanks, members of the public health team. I thought I did that at the start, Phil, but anyway. In their work.
Chair, sorry to come in. I've just put my hand up again.
Yes, Councillor. Yeah.
It's just adding on from Councillor Frost, actually, and it describes vulnerable people. I'm aware of, certainly within my ward, of people who are living on their own, who don't have immediate family. They wouldn't describe themselves as vulnerable, but they don't have much of a support network. And I'm wondering, a lot of these people are elderly who are self-isolated. Is there any way to track and contact these people? I know it's incredibly difficult, but we don't want these people to be forgotten. And off the top of my head, I can think of half a dozen people in my immediate vicinity. And in certain areas, people will be reluctant to open doors, or the elderly people are fearsome of strangers knocking on doors and so on. Do we have any kind of data on these people who live alone and not necessarily ordinarily classed as vulnerable people, but certainly during this pandemic probably are? I don't know if we can have any information or any thoughts on that.
Yeah. So Councillor, the main way that we're trying to connect with people is through our network of community champions. So they're people that have been recruited, say, from the faith sector, or from local groups that want to be informed of what we're doing, and just to keep that eye out and to support their neighbours. So we're using our community champions as a low-level intervention to support people as appropriate, and I'm hoping that was something that can certainly ramp up over time, and as I say, be that low-level intervention for people who aren't normally in contact with services but are feeling vulnerable at this point in time.
Right. Thank you, Julie. And Graham, I was going to say, have you got something to add to this? But clearly you have, because your hand's up.
Yeah, thank you. Yes, thank you, Chair. Just to say that we're working very closely with primary care. Primary care have vulnerable people, and that's a range of people, from those that live on their own and those that were formerly shielded and classified as extremely vulnerable on their lists. And I know they've been making contact as well. So in addition to what Julie's just said, we've got a very close working relationship with primary care. They're making direct contact. And of course, the voluntary sector has been working very closely across the borough as well, and making contact with a whole range of people that would find themselves as being vulnerable and isolated. I have to say, there has been a report from Age UK that a number of older people are sealing themselves off, closing the curtains, taking to bed. So we have been working with Age UK to make sure that all of those people get direct contacts as well, so that we can make sure that they've got support in relation to heating, food, all of the kind of basic needs that you would expect people to get help with. So I think there's a number of elements to this.
Thank you, Graham. Hopefully that reassures you, Councillor Cottier.
Yeah, can I just would it be possible to I don't know if you got any collated lists of these groups that we could do as a ward-based thing, so ward councillors can have these maybe to support. I know we have our ward budgets, maybe we could offer support in that way. Obviously we need everyone pulling in the same direction, and every little helps, so to speak, but if that is any way that could be done. For instance, in Bebington, obviously we've got multiple groups, but if Age UK is an outside body working within Bebington, if they have a contact and possibly, I don't know how that'll go on with data protection, but possibly let local councillors know, and we might be able to do some direct support or approach other support groups to maybe produce more of a network of support. I know it's already in hand, but the more people involved in the network, the greater it is, of course. So I don't know if that's something we've done. It's just a thought anyway. But thank you for the replies. Cheers.
I think that may need some thinking through, Councillor Cottier, and I'm sure that Graham will have a look at how that can happen, Graham, or if that can happen, and the best way.
Yes, of course.
About it. Right, thank you. Any further comments? I've got a note here from Councillor Gilchrist in the chat that the committee wants to record its thanks. As I say, I thought I'd done that at the start, which I assume has been recorded. And Councillor McLaughlin is keen to include Councillor Gilchrist's comments in addition to the recommendations. So I think we're all on the same page there. Wanting to, we're asked to note the contents of the report and the progress made to date and support the ongoing COVID-19 response. And I think that we're also going to add to that that the committee records its thanks to all those members of the public health team in their work to combat the spread and impact of the virus, as Councillor Gilchrist has written in the chat. And hopefully my comments at the start were also recorded in the minutes. So, if there's no further questions for Julie, thank you very much indeed.
Thank you.
Julie,
Thank you, Chair.
And we'll move on.
Chair, can I just confirm that Councillor McLaughlin is formally seconding what Councillor Gilchrist has moved?
Yes, I'm happy to do that.
Yes.
And the committee are agreeing that by assent?
Yes, the committee are agreeing that. Yeah.
Okay.
Right, so then we move on to item 5, which is the domestic abuse strategy, and welcome to Elizabeth Hartley, who's going to take us through that. Oh, Councillor Usher, got your hand up? No?
Yeah, I'm fine for now, Chair. Thank you.
Oh, right, okay. Right, Elizabeth, do you want to take us through the domestic abuse strategy?
Thank you, Chair. Good evening, everyone. I'm really pleased to be here to present our new co-produced domestic abuse strategy. I'd like to start by just giving some brief overview about the process that we went through to inform and develop the new strategy. There was some key activity that's taken place but one that wasn't affected by COVID. That 12-month analysis gave us a really good understanding of the prevalence of domestic abuse in Wirral, as well as the characteristics of victims and perpetrators, of gender breakdown, ages, locations, etc. So that has informed the strategy. We also undertook a really comprehensive learning review of a case that was open to children's social care, which was very complex. There were issues around family court, parental conflict, parents' ability to engage with the statutory process and the experience of the children. So we gained a lot of important learning from that. We had a task and finish group which looked at the performance data to propose a new set of meaningful performance data, and also looked at outcomes for children who were living with domestic abuse in their households. We undertook an exercise to review the existing commissions and resources that are delivering services for domestic abuse across Wirral. We held a series of workshops with over 60 professionals from a range of different organisations. But most importantly, we undertook consultation and engagement with 92 people who are affected by domestic abuse. And I would like to formally thank our local voluntary organisations who facilitated the majority of that work and did a brilliant job of getting a good understanding of the experiences and the views of the people who are affected in Wirral by domestic abuse. When writing this strategy, we've made a very deliberate shift in the tone and how it's presented by deliberately writing the strategy to the people that are affected by domestic abuse. The feedback we've had from that has been really positive. People feel that they can engage with it, they can understand it, and it's more focused around experience of those people rather than being focused on services and processes and structures. So that's been really positive. Our ambition with this new strategy is for Wirral to be a place where as few people as possible are affected by domestic abuse, but those that are able to get the help they need to end the abuse and to go on and live the lives they want. There are 5 priority areas which are detailed in the strategy, and for each of the priorities there's a breakdown of why that's important to the people and what we need to do and the actions that we're going to take to achieve those better outcomes. We're proposing to deliver the strategy in 3 phases. It is a 5-year strategy with a delivery plan. In years 1 and 2, we're looking at a transformation phase, which will focus very much on people's experience and the response that they receive when they disclose, how easy it is for them to access help and support, and that the help they can get is not determined by thresholds, because that tends to just escalate problems until later on. So we are looking to transform that into a broader, more equitable offer where people can access help as early as possible. In the transformation phase, we will also be launching some new models, looking at system learning, and very importantly, there are some underrepresented groups that we need to do some more work with. That includes older residents, residents who have special education needs and disabilities, as well as some people who are living in more affluent areas who have not felt able to come forward and disclose domestic abuse. Year 3 will be an adjustment phase where we will look back at the learning and make any changes that we need to. And years 4 and 5 will focus on embedding the work, and the full details of that are in the delivery plan. In section 4 of the report, we're looking at the financial implications. We're noting the need for additional funding. Since writing this report, we've actually been successful in drawing down some external funds as well. So we've secured an additional $350,000 from What Works for Children's Social Care to launch a 12-month programme to look at how we can change the experience of people affected by domestic abuse who are involved in the social care process. Really pleased to say that that programme will create some jobs for peers who've been affected by domestic abuse to work alongside social care, which you can tell from the report was really important to the people that have been affected, that they want us to use their experience and knowledge to work alongside professionals. We've also secured $50,000 from the Violence Reduction Unit for domestic abuse, and we're seeking $200,000 from the Troubled Families Transformation Grant to help with that transformation phase of work. In year 1, we will be looking at the partnership offer for domestic abuse, which might have some implications about our resources and funding, and we will bring back findings from that to the committee. The delivery plan is included for members' reference. That will be overseen by the Domestic Abuse Alliance with subgroups that will lead on the work streams. We will do a formal review on an annual basis, which we will present to the committee, and we will of course continue with co-production at all stages of this, with residents being involved in the groups. And we are at the moment planning a partnership launch for the strategy in December. Happy to take any questions.
Thank you. Thank you very much, Elizabeth. As you know, you don't need me to tell you how delighted I am with this strategy. and the way in which it's been produced, and long may we continue to work in that way. I've got, in the order that the hands went up, Councillor Usher, Councillor McLaughlin, and then Councillor Frost. Councillor Jordan. Councillor Usher.
Thank you very much, Chair, and thanks, Elizabeth. I really wanted to just say a few words on the strategy myself, because for those who not as aware of the history, this is a significant piece of work that's been going on, and it's something that I've had involvement with, and so has Councillor Nolan as the domestic abuse champion, I think it's important that I express just how important it was to get a number of changes in our approach right with the strategy, and Elizabeth has covered the important points, but I just wanted to highlight some of them, which is a shift in terms of the language used and the style in which the strategy is written, which reflects our commitment to make it as likely as possible that those living with domestic abuse feel able to step forward. There's an ambition to do more to challenge perpetrators more comprehensively, and a wider consideration for how we ensure the onus is minimised for survivors and victims by how services approach supporting them. A huge amount of work was undertaken by officers, partner organisations, by, as I say, Councillor Nolan and Elizabeth Hartley, who have showed absolute dedication and passion right through the whole process, and for that they have my sincere and deep thanks, because this is so essential that we get our domestic abuse strategy right, with the work that's been undertaken around data that would help us measure and understand, firstly, what survivors are dealing with, and secondly, what our impact is, what impact services are having. The quality of this strategy is thanks to all those survivors as well, who shared their knowledge and experience, told us what we should be doing more of, and importantly, where we weren't getting things right. It's been a huge piece of work and couldn't have been done without those voices. So I'm sure that by the number of hands up, the strategy has generated the interest that it so rightly deserves. But I'd just like to propose that the committee accepts the two recommendations, fully endorses the strategy, with a view to monitoring progress of the delivery plan at an appropriate time, because one of the virtues of this is that obviously there are periods of reflection throughout the strategy to ensure we are learning as we go. So with a view to monitoring progress of the delivery plan at an appropriate time, and committee puts on record its thanks to all those survivors who stepped forward to shape this strategy by sharing their experiences, as well as those organisations that helped facilitate this. Thank you very much, Chair.
Thank you, Councillor Usher. Councillor Frost, and then I've got Councillor McLaughlin next, and then Councillor Jordan.
Thanks, Chair. I would like to add my thanks to Elizabeth as well for this strategy, which we've talked for a number of years, when we had the Families Committee and more recently in the Adults Committee, about getting a strategy which we felt was going to produce results, and I'd like to add my words of thanks to you for producing this, and I know there's a lot of work gone into it. There's a couple of things that I particularly appreciated. I really like the way that it's focused on people who have been impacted on by domestic abuse, whether that be perpetrators or victims. I like the I like the fact that you've included older people in this, because they're very often overlooked in the context of domestic abuse, and yet there are types of abuse which they are particularly vulnerable to. I'd like to highlight an area where I think might be a sticking point. in the delivery, which is suitable housing and availability of refuge places. Housing haven't always been the full and active partners that we would have wanted them to, both social housing providers and council housing officers. So I'm really keen to see how that will work. But there's a bottom line here, and that is how does this differ from previous attempts to reduce the prevalence of domestic violence, and how can we see that difference over that 5 years rather than wait till the end of the 5 years and then monitor its progress? What are you going to do to let us track your progress on this, or track the progress?
Right, thank you. Councillor Frost.
Thank you, Chair. And Elizabeth, thank you so much for the comprehensive the report and the update. Chair, if I'm able, I'd like to second Councillor Usher's motion, and I also just have a few comments and then a question for Elizabeth. Congratulations on the additional funding, Elizabeth, absolutely well deserved, and not to restate the comments that have come from Councillor Usher and Councillor Nolan, but what a fantastic step on in terms of centring victims and perpetrators and survivors and families at the heart of your work. In reading the report, I know we discussed it as a Labour group beforehand, but one of the particularly shocking of children who themselves are involved, which I think it was really useful to bring that level of data to light so that we could understand the wider impacts, which I know is central to the work you've been doing. The question for me is around, you mentioned the underrepresented groups in your talk earlier. I was also reading through your work on groups from protected characteristics, and I know in your SL4, in your delivery pack, the priority for that group is to undertake a study into the experience of underrepresented groups. I would be really keen to understand what specifically that work will look like, and if you've got any more information to share on that, that'd be really useful. Thank you.
Thank you. Elizabeth, do you want to respond?
Yes, thank you, Councillor Frost. At the moment, we don't have any detail on that under how we're going to engage with those underrepresented groups, because the subgroup of the Domestic Abuse Alliance will work that out. But I'd be more than happy to share that once we've got a plan for that.
Thank you, Elizabeth. Yeah, that would be that'd be fantastic. Do you have a timeline in terms of when you think that will happen?
We're looking to commence that next month in November with the work group.
Okay, fantastic. Well, I'm sure members of this committee as well, but very, very keen to read that next month. Thank you.
Councillor Jordan, please. You have your hand up.
Thank you, Chair. Thank you, Elizabeth, for your report. I'd echo everything that everybody said before me. There's no point me repeating that. I just have one question. Going back to the previous item, how has COVID impacted on the strategy, and what will be the actions going forward to cope with that?
Thank you. It's been very difficult actually to understand the impact of COVID on this group of people. We've had a fortnightly group which has met to make sure that we can meet the capacity and demands, but we haven't seen an increase in demand for services that we expected. At the start of lockdown, people were talking about 3 times the level of demand. We've not seen that in Wirral, and I'm also part of a Merseyside group where that's not been the case either. What's been interesting is we've had more historical disclosures of domestic abuse, but we do anticipate that we're going to be dealing with the impact of lockdown for the next 2 to 3 years, which is going to likely be up to about a 40% increase in demand, which we're going to need to try and figure in with our projections and resources that we're going to need to be able to respond.
Thanks.
Thank you.
Thanks, Elizabeth. Right, I've got a comment here from Councillor Gilchrist, who says that he appreciates the powerful quotes that are included in the document. I think we all do, and they give us all food for thought. but he's wondering if there's likely to be any easy access guide that might flow from this with the key contacts for those living in fear. Elizabeth?
Yes, we're working on those at present, and we'll have them ready by December when we formally launch.
Right. That's helpful. Thanks, Elizabeth. And Councillor McLaughlin would like you to address the issue of performance monitoring, please.
Yes, I think one of the big lessons we learned from the previous strategy was around the need to have performance data which shows impact and change and doesn't just count and measure the numbers coming through. The task and finish group that I mentioned previously, they've been looking at how that can be done. So they've pulled together a new performance data set which will mix quantitative and qualitative outcomes. So we're going to introduce an outcome star, for example, which will give people that are affected by domestic abuse the opportunity to feed in their experience and what's changed from them, to be able to show how daily life is changing for them and hopefully improving. The measures that we're looking for, which are quantitative as well, are much more focused around completion of perpetrator programs, DVPNs, which are domestic violence protection notices and protection orders, how they're being used. So trying to really nail down a lot more of the not data that just counts numbers, but data that shows changes. The data set will be reported to the Domestic Abuse Alliance, and we'll come back to this group as well.
Thanks for that, Elizabeth. Can I just come back on particularly think about perpetrators of domestic violence, because quite recently I received, and I'm sure other councillors did as well, a request from an organisation who are providing, what's the name of the programme for perpetrators of domestic violence? I forget what it's called now. But they were saying they were delivering this, and I'm wondering whether they are delivering it independently of the council or whether they are part of your alliance. Can you help me with that? I'm always a little bit worried when organisations take on a role and don't necessarily link it in with the work that's already being done. And I'm not sure that this organisation are, and they were, I mean, they asked me for a donation. I'm absolutely sure they will have gone to other councillors as well. Can you help with that, Elizabeth?
Yeah, the organisation that we're going to be working with to deliver the perpetrator programme is called Drive. That's a partnership between Safe Lives and Respect, two of the national charities, and it's been co-funded by the National Lottery. But if you'd like to forward me any contacts for other organisations, I'd be happy to look into those. But it's Drive.
I will check out it. I didn't respond in terms of giving them money, I have to say, because it did worry me that perhaps it wasn't linked in and with the work that you're doing. But thanks anyway. I'll have a look at it.
Thank you.
Thank you very much. Thanks for your responses, Elizabeth. We've had a proposal, and it's been seconded. Proposal from Councillor Usher, seconded by Councillor Frost, that we endorse the recommendations as requested, and that we fully endorse the strategy with a view to monitoring progress of the delivery plan at an appropriate time, and that the committee puts on record its thanks to all those survivors who stepped forward to shape this strategy by sharing their experiences, and those organisations that help facilitate this. That any objections to that, or can we take that by assent? Right, I will take your silence as assent, members. Thank you very much for that, and thank you, Elizabeth.
Thank you.
You got a legacy hand up, Moira?
So sorry.
Thank you.
Not usually guilty of that.
No, sorry, it was your term I was using. I liked it. Okay, thank you. Right, we will move on, as we're already not strictly at the time that we'd like to be, because we do have a workshop which will be starting at the rise of this committee So we're moving on to item 6, which is the budget process, and that's down to you, Graham, I think. Yeah.
Thank you, Chair. So the paper agenda item 6 is a paper setting out the budget process for 2021 to 2022, and it sets out the process for setting a legal budget in the context of an identified budgetary gap. And during Q1 that gap was seen to be 45 million. But as you'll hear later on, that's constantly being reviewed and may well be going up. This paper sets out a 5-stage approach and, importantly, the decision timeline that sits alongside that budgetary process. So the committee is asked to consider the Council's financial position and the process that's set out in this paper. Section 3.3 sets out the forecast in relation to the council deficit. In 3.3 it set out that deficit had at that point been reduced to £22 million based on additional funding that come through to the council. And 3.4 shows how that deficit is made up, including the reference to adult social care within that makeup of the deficit. Section 3.5 identifies the requirement to take action on the worsening budget position, and as we'll see later on in the paper, some actions have already been taken and some actions are indicated in terms of moving forward to address that budgetary gap. 3.6, there's a very important point that the council has requested permission from MHCLG to apply to the Treasury for a capitalisation directive to help us with the short-term budgetary pressures and give us time, in essence, as a council to respond to the difficulties that we have. 3.7 to 3.9 identifies the current forecast gap for 21-22 at 45 million. Over the next 2 years, so including 2022, up to 67 million. However, there is a warning there that the forecast may worsen as we work forward through the COVID crisis and continually understand the changing position that we have as a council. Section 3.12 to 3.13 sets out those 5 core elements of the process. Number 1 is the immediate actions that have been undertaken. Section 2 indicates that directorates have been asked to put together proposals based on, if you like, a set of proposals that will address the gap. However, they are for further discussion through a workshop on the rise of this meeting, and those proposals are in early development, and certainly they are subject to views of elected members and also additional ideas that may come from this committee. Stage 3 was categorisation into themes, and those themes include a review of whether statutory services are efficient, so that applies very much to the budgets that are held within this committee. The outcomes that non-statutory services deliver and whether they are the right outcomes. Income generation, does this provide services that have income generation, do they provide a good return on investment? And back office costs, are they reasonable and appropriate to the size of services that they support? Section 4 is corporate challenge, and that's where those themes are further broken down into 7 work streams. and there is some detail of specific pieces of work identified within there. One of those is the cost of care model for social care, which would be a review of what we pay for care services and whether, again, that's the most appropriate level of investment. So part 5 of that process, finally, is a contingency plan, which would look right across the council at what the impact of 5%, 10% and 15% cost reduction would have, and clearly that approach would have a number of risks, and again to be further discussed with elected members in terms of the impact of that type of approach. There are a number of things that we clearly do not know at the moment, and 3.14 sets out that one of those things is the comprehensive spending review. The resources coming from government are not known at this time and clearly haven't been scheduled in to the budget setting process, and that's key actually to budget setting, where the pressures in social care for adults and for children are well known nationally, and we would hope that there is some response there. And also potential further COVID-19 funding has not been scheduled in there again because we're at this point in time we're not clear exactly what that would be, but again we'd be looking for those types of elements to be brought in. 4.1 sets out the overall timetable, and 4.5 to 4.8 refers to the budget workshop that we are looking to have. Now, actually, what we would have is more than one budget workshop in order for elected members to look at the detail of potential areas of service cost reduction. And 5.2 sets out the overall budget for the council and gives a breakdown of this committee budget also. I hope that's useful in terms of a rundown through the paper.
Thank you. Thank you very much, Graham. Questions and comments? I've got your hand up, Councillor Usher. Is that intentional? Yes.
It is. It is. Thanks, Chair. So obviously we're on the we're at the start of a process where some tough financial decisions need to be made, and since I joined the council in 2016, my focus tends to have been on the statutory services, and speaking to officers within adults and children's as well, it becomes abundantly clear that there's a real difficulty when talking of budget reductions, because a well-oiled and funded system does more to manage demand than does an underfunded system. We've gone through an extraordinary period of time where small efficiencies, don't come up to the size of the problem, because we've gone through an extraordinary period of time where we've had 10 years of reductions in funding to local government, and we've had most recently a global pandemic, which we of course are part of, and some quite lacking support in the most recent second sort of spike in cases when it comes to funding for our statutory services. As this funding's decreased, our statutory responsibilities have not gone away. They've remain the same, or in many cases actually the demand has increased, or councils have been given additional responsibilities. So I think there's a steer from the council leader, obviously, who wants to make reducing social and health inequalities a number one priority. And I think from conversations with both politicians and officers, there's a recognition of the difficulty of budget reductions in these statutory services. There's plenty of things that you can do for invest to save, for example. Plenty of things that you can do, to ensure an efficient system is running and that demand is being managed. But extraordinary difficulty when you take money out, because that usually actually leads to what happens is you have a small saving in the present that leads to increased pressures in the future that usually both absorb the saving and then some. And that's not to touch on the human cost of this particular strategy when it comes to the statutory services as well. So I suppose I'd like to hear some of that stuff can't be touched by officers, but I'd like to hear the kind of the perspective of perhaps some officers on how we approach the budget process from the perspective of statutory services, because it would seem, talking to them, that there's not really that much left in terms of cutting, and we're on the cusp of a period of time that's going to be extraordinarily tough for many of our residents. So, my perspective might be that we protect those statutory services. So I would like to hear some perspectives from officers on what approach we need to take when it comes to both adult services and other statutory services. And I would like to propose as well that that committee wishes to highlight the importance of social care and health services at this particular time. The committee expresses its support for a budget process that takes into account the statutory nature of these services and the difficulty in making budget reductions without more costly demand pressures occurring subsequently. For these reasons, this committee will make budget proposals based on invest to save principles and delivering our services differently rather than budget reductions, and that we ask Policy and Resources Committee to support the decision of this committee. The committee is acutely aware of the extreme budgetary pressures on all services, and as such proposes that the budget consultation is more widely advertised to capture a greater understanding from all stakeholders' opinions and concerns. And I'll put that in the chat as well, Chair.
Right. Thank you very much, Councillor Usher. Is there a seconder for that? Councillor Frost?
Thanks, Chair. I'd like to second it, please.
Okay. Do you want
Can I comment on that? I'm uneasy at putting anything down as a recommendation at this stage of the process, to be quite honest, before we've had the chance to have those discussions, very open discussions, I hope they will be, where we aren't constrained in any way during the workshops that we've got lined up. So though I don't agree in principle with what Tom is saying at this stage, I'm not keen to enshrine that as a recommendation at this point, which is not to say that further down the line we wouldn't, as a result of the deliberations that we have, come up with something which is very similarly worded. But I'd rather not do it at this stage, I'm sorry to say.
Okay, thank you. Councillor Gilchrist.
I'll study what Tom has put in writing because it has just popped up. I think for all members across the council, our problems appear enormous, even unsurmountable at the moment. And what I've said in various places is that I don't wish to demolish the underlying fabric of our society or communities. You remember, or won't remember, all members might have read that in March the Chancellor Exchequer talked about doing whatever it takes. And whilst much of that debate was focused on the economy, having local services that help people underpin the economy. So I'm hopeful that in our discussions we have that in mind as well. The committee, of course, has had considerable strain, difficulty in delivering what's required statutorily, and I'm very mindful of that. But I would like to hear a bit more of the debate around Tom's wording, which I'm now studying. Thank you.
Thank you. Councillor Foster, do you want to say anything? No. Okay. Says there's one other hand. I just can't see whose it is. I think your hand is still up, Councillor Usher. I think that's probably what it is. Okay. Councillor Usher, you asked to hear from officers. I think probably Graham can speak in very general terms, but we'll obviously have to tread a fine line in terms of what he says at this point. Clearly, we've got workshops, and we have a workshop immediately following this committee where it may be possible to have further discussions. But I don't know whether there's anything you want to comment on at this point about the issues that Councillor Usher raised about the difficulties of service reductions, Graham.
Thank you, Chair. First of all, I'd like to apologise for not having my camera on when I was speaking before. I only realised when I finished speaking that that I had the microphone on but not the camera, so I will be a bit more careful in future. Yes, I mean, working to respond to increasing demand has been a particular issue for us in statutory services, and what our approach has been in recent years has been to try and change the nature of that demand by looking at where people live, trying to ensure that appropriate housing is in place, looking at how we can support people with new types of technologies to remain as independent as they can within their homes, so assistive technologies and health technologies, and working with voluntary sector organisations and others really to try and work early to prevent people becoming more dependent upon services. We are clear that there's more to do in all of these areas. I think that when we go to the workshops, you'll see a mixture. There are some things that relate to those types of changing how we work with people to operate in a way that supports people to remain as independent as they can be, and you will also see some things which are more about short-term types of savings. I think it's been important from a council perspective to leave no stone unturned, so that as we go to MHCLG to look at the capitalisation issue, they need to hear that we've looked at absolutely everything. But I completely understand, and I think that we've got to be very careful not to look for short-term gains that actually cost more in the long run. And I think that's where we'll be very keen to hear from elected members in terms of your views and those areas that you feel we can work on together to achieve that issue of really working to support people to be as independent for as long as they can be, and to have a cohesive approach to preventing people needing lots of support from statutory services.
Thank you. Thank you, Graham. I can't see any other hands up. We have a proposal on the table which has been seconded. Councillor McLaughlin's already indicated that that's not something...
I'm trying to put together very quickly, as I wasn't expecting at all to have any form of sort of a recommendation at this really early stage in the process coming forward. I'm trying to put something forward, pushing something into words at the moment, but it's my typing skills are not as good as my, well, actually probably better than my brain, but I'm just not getting it down quickly enough to put forward. But I want to put something forward which says that, first of all, that the committee recognises the extraordinary difficulties in producing a budget and the pressures that there are, and fully understands the demands on the statutory services and those services which promote the independence and well-being of most vulnerable people. I want then to highlight that the workshops which members will be fully involved in and engaged in are the areas to explore all possibilities, and committee hopes to produce a report which all members of the committee can sign up to, which will make our views known to P&R at that time. I don't want to go into P&R at this time or send anything to P&R at this time which constrains us in any way. I want to leave all our options open at this stage, and I don't think I can support Tom's recommendation at this time, though, as I say, I might very well support it at the end of the process that we're about to go through. I think it's premature at this stage. But you know, it's up to committee members what they choose. I think at the end of the day we will come up with a report which we will all understand all the implications of the things that we've looked at, but we don't at the moment.
Thank you for that, Councillor McLaughlin. It's clear that we can't move this by assent. Councillor Usher, did you want to comment further before we put this to the vote?
I suppose it's the emotion is more a. I think the motion is more a indication of the approach that we would wish to take, and what our focus should be. And I suppose I'd have to ask. Well, I mean, just to alleviate Councillor McLaughlin's concerns and Councillor Jordan's, I think. Well, I'd have to ask Vicky, really, if that's okay, Chair. You know, would signing up to this particular motion mean that the committee would be less free to sign up to or to support any of the particular suggestions that come to the workshops? Because, well, I wouldn't think that would be the case, but I just wanted to get that view, really.